Hi, nice to meet you. I am Dr. Henry Capaldi, and welcome to West Winston Medical Center. First things first, you're here for your general physical examination, correct? Wonderful. Alright, in that case, I'm just going to take your temperature really quick, if you don't mind. Good. This won't take a moment, I promise. Alright. And I'm just going to hold this near your forehead, okay? Good. Alright. Very healthy. Alright. Wonderful. If I can just ask you to please confirm your name and birth date for me. Perfect. Alright. Now that we know that you are who you say you are, and that you are, at least from a disease standpoint, perfectly healthy, we can get started, okay? Wonderful. In that case, I'm just going to take a general look at you. Good. Alright. And just get a sense of your pallor, general color, and make sure that, I'm not seeing anything immediately concerning. For instance, we don't want to see any discoloration of the skin, especially in the face. We also don't want to see any signs of anxiety or stress, bags under the eyes, that kind of thing. So, all right. Good. Perfect. All right, you have a very healthy color about you, okay? Wonderful. Let's move right to the next step if you don't mind. Good. In that case, I'm just going to take your pulse and make sure that the heart is working as it should, okay? Wonderful. All right. And if you just hold still for me and relax, breathe normally, gently. Good. Okay. That is a very healthy resting heart rate, okay? Wonderful. Good. Okay. Now that we have some of the crucial measurements out of the way, your pulse, temperature, that kind of thing, we're going to move right into the eye examination, okay? Just to make sure that your eyes are healthy and functioning exactly as they need to. So, first things first, this chart. We're just going to do the standard eye test chart, okay? Just a few really quick exercises to make sure that your eyes are functioning as they need to, and that you can see reasonably well out of both eyes, okay? So first, I'm just going to hold it at this distance. I want you to read line 7 for me, okay? Good. Good. Excellent. All right, now if you'll please cover your left eye and read line 8 for me. Good. Wonderful. Perfect. Now if you'll please cover your right eye and read line 8, but this time I'd like you to read it backwards, okay? So from this side over to this side. Good. Perfect. All right. Wonderful. You can officially see quite well out of both eyes. Not that there was ever any doubt, but it never hurts to check. Alrighty. Next, I'm just going to be using this pen light to do a few quick examinations of your eye, if you don't mind. Wonderful. If you'll please open up your left eye for me. All right. Good. And I'm just checking the general color, make sure that everything is looking as it should. Good. Now for the right eye. Good. Perfect. All right. Next, I want you to follow the pen light with your eyes at the same time. So if I were to move it over here, I'd like you to track it without moving your head, okay? Perfect. We're just doing this to make sure that the eyes are tracking in tandem, and that the movement is smooth and fluid. That is, there's no jerkiness with one eye to the next, and your eyes are tracking at the same time, okay? So in tandem with one another. And they were, that's no problem. But if they were moving in a jerky fashion, it might be something to consult with your optician, or examine a little bit closer while we have you here, okay? Next, I'm going to take my finger. I'd like you to focus, please, on the very tip of my finger, alright? Perfect, okay? And I'm just going to bring it slowly closer and closer to the tip of your nose, okay? Good. Now I'd like you to please switch your focus from the tip of my finger to the tip of my nose, okay? Good. Good. We're just going to do that one more time, okay? So focus on the tip of the finger. Closer, closer, closer. And tip of the nose. Good. And that's just to make sure, again, that the eyes are tracking and that they can switch focus without any substantial delay. Okay? And, of course, you performed wonderfully, so no cause for concern there. Good. All right, now I have a different pen. We're just going to conduct some rudimentary hearing tests, okay? So, when you hear the click of the pen, I'd like you to just raise your finger, okay? On the side that you hear it. So please close your eyes, and then when you hear the click of the pen, raise the finger on the side that you hear the pen on, okay? Good. All right, next. Good. Finally. Good. One more time. Good. 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 All right. Open your eyes, please. I'd like you to please cover your left ear for me, okay? Good. Any substantial problems with hearing any of that? Did it sound garbled at any point, like the pen was clicking underwater? Good. Nice and clear. Excellent. If you could please do the same with your right ear. Good. Okay. Good. 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 And same with that ear. Excellent. That is what we like to hear. That's perfect. All right. Next, I'm going to do a quick examination of your ear, nose, and throat. We're going to start off with your throat, and I'm just going to be using the same pen light again, okay? I will be using a tongue depressor. Now, I'm not going to be pushing this aggressively into your throat. I'm not going to be forcing it into your mouth. I'm just going to be using it to control the tip of the tongue, okay? So don't worry about any gag reflex. This is just so that I can get a good look at the color of your throat and tonsils, make sure nothing is swollen, okay? Good, so please open very wide for me. Open up. Keep that tongue down, keep that tongue down. Good. Okay, one more time for me, all right? Open wide, wide, wider, and... Good. Okay, that's looking really good. Perfect. I'm going to slip my gloves on for this next part, okay? Wonderful. And of course, we have everything sanitized and packaged. So these are brand new, never been worn gloves. So no need to worry, okay? Good. I'm just going to be doing a quick examination of your ears and throat. Just looking again to make sure that the color is good and that there's no obvious swelling, discoloration, any painful nodules or ingrown hairs, nothing like that to worry about, okay? Perfect. Alright, so again, we're just using this pen light. And if you would please lean your chin back for me just so I can get a good look in your nose, okay? That's not the most comfortable position, I'm sorry. It'll be quick though. Wonderful. Looks good. Not seeing any ingrown hairs, not seeing any buildups, and it was a good color, so onto your ears. So first, this side. I'm just going to come around. Good. Okay. Perfect. And the other side for me. Good. Perfect. Excellent. No waxy buildup, no ingrown hairs. Everything looks like it's functioning as it should. You haven't had any painful trouble swallowing, difficulty hearing, or feeling like you couldn't clear your ears, anything like that? Good. Okay. Your nose, everything's been healthy there. No excess nasal drain, mucus, anything like that? Good. Perfect. That's what I'd like to hear. It is allergy season, but I didn't see any allergies reported on your form. Is that correct? Good. You're a very lucky individual. Yes. I myself need just a little bit of help to get through these seasons without swelling up like a balloon. So good to know that there are still people out there who don't need any sort of medical assistance. I'm not jealous at all. No, don't worry. All right, next, I'm going to be feeling the lymph nodes in your neck, under your jaw, and I'm also going to be feeling around the shoulder area, okay? So please let me know if anything is particularly sensitive or painful. Okay? Good. I'm just feeling around the lymph nodes. Okay. Good. Now moving down the shoulders. Good. Any pain, stiffness, noticeable discomfort with the shoulder areas or any of those joints? Nothing like that? Good. You haven't been sick in the past couple of weeks at all? Good. I didn't notice that the lymph nodes were inflamed at all, so that is usually a good sign that your body is working as it should. The immune system isn't under any excess stress, and the body is recovering from any particular ailments that might be in your system very quickly, okay? So that's good. Wonderful. All right, next, I'm going to do just a quick test of your respirations, all right? So we're going to do some brief breathing exercises, and I am going to take a little listen with these, okay? So first, I'd like you, I'm not going to use these quite yet. First, I'd like you to just take in a few deep breaths with me, okay? So on 3, we're going to breathe in through the nose, and then we're going to breathe out through the mouth, all right? And I'll direct you through it, so it won't be a problem. All right, first, in through the nose, hold it, 1, 2, 3, and out through the mouth. Good. 2 more from me, okay? 1, in through the nose, and 2, out through the mouth. Good. 1 more. Good. Excellent. All right, now I'm going to take this and I'm just going to put it at a couple key places on your chest and on your stomach, your diaphragm. I'm just going to do it over your clothes, so it won't be an issue. This isn't particularly cold, but I know a couple patients who really don't like, the bare metal against their skin, so we won't have to do that. And then I'm also going to be moving around back and doing the same thing on a couple key locations on your back, okay? So every time you feel it, just please give me a nice deep breath in, okay? And then just a natural breath out. Good. All right, let's get started. In. Out. Good. In. Out. Good. In. Out. 1 more. In. Out. All right. I'm just going to move around back a few, okay? Good. In. And out. In. And out. And a really big deep breath in. And then out from you, okay? Good. That was perfect. Exactly what we needed, okay? everything sounds really good. Not hearing any, the body is working exactly as it needs to, so no excess work, alright? You can sound, sometimes with certain respiratory illnesses, there's almost a whistling, where air isn't moving where it should in the body. Not hearing any of that. Not hearing any, sometimes the body is working very, very hard to bring in air. You can almost be gasping, but your breaths are very fluid, very smooth and seamless, alright? No excess effort. With that being said, we've kind of ascertained that your sensory organs are all working as they should. Your breathing and cardiovascular system seems healthy. All that's left to do is really check the muscles and nerves, alright? So that's going to require a little bit of effort from you. I'd like you to please stand up. Good. First things first, give me a few stretches of your neck, alright? So just mimic me. Good. And back. And forward. Good. Alright. Now I'd like you to please take your hand and just stretch to the side, okay? Good. And now with the other side, please. Good. Any discomfort, pain, stiffness that you've noticed day-to-day in joints, muscles, any achy feelings? Good. Okay. A little bit in your lower back. All right. Do you work a desk job? Okay. So quite a lot of time sitting down. All right. That's no problem. If you can, I would look into purchasing some lumbar support for you, okay? Really helps to reorient the posture so that the spine is in a more natural sitting position, and it also helps to increase the body's ability to stay sitting comfortably for longer periods of time. I know that a lot of people that can't sit still for more than an hour or two without that back pain flaring up. This will help to alleviate that and allow you to sit for longer durations. Very cost effective. Just a little bit of mesh lumbar support. You can get it at your local office supply store or the medical supply store, okay? Good. No, you don't need a prescription for that, no. Nope, not necessary. Wonderful, alright? I'm going to ask you to do a few other basic stretches, okay? I'd like you to please lean forward and get as close as possible to touching your toes, okay? I'm just going to come back around you, make sure that your spine is in alignment, alright? Good, so please touch your toes. Alright, and that's about as far as you can go. Good. Good. Okay. Spine is in alignment, no problems there. Alright, next I'd like to test your balance if that's okay. I'd like you to stand on one foot for me, please, alright? Good. Please don't hold your arms out. I'd like you to keep them close, tight to your chest, okay? Good. Okay, spread your arms out, please. Just like this. Good. All right, and switch feet, please. And hands back to your chest. Good. And now arms out, please. Good. Any bouts of vertigo that you've noticed? Any point where your equilibrium hasn't been set? No? No dizziness to report? Good. Okay, that's what we like to hear. Good. Okay. Next, if you would please take a seat up on the bed. We're just going to check your reflexes really quick, okay? Good. And I'm just going to use this pen. Alright. You know how this goes, right? Good. Alright, please relax the muscles in your legs. Good. And good. And the other leg. Oh, sorry, I was a little off. There we go. Good. Alrighty. Your reflexes are good. No pain, stiffness in the hip, leg joints, ankles, feet. Good. Okay. I noticed your report said that you have somewhat flat feet. Has that been bothering you at all? No. Good. Really, as long as you have a supportive shoe, and I see that the shoe that you have on, I believe that's a fairly good brand for that. As long as you have a supportive shoe, that when you're walking long distances or walking for an extended period of time, you're able to have those on, you're really not going to notice it. Flat feet are this very common occurrence in people nowadays. The arch, whether due to just not walking around enough, or I used to walk on my toes everywhere for some reason as a child. Those can help to flatten the arch. There are ways to bring it back, but if it's not causing any pain or any discomfort, and you have that supportive shoe, there's not really a reason to pursue it unless something changes, okay? So please let me know. We just want to make sure that the body is staying in alignment, especially in the spinal column down to the hip, okay? Because that's really where the pelvis can be a source of a lot of pain, and any misalignments in the feet can extend up to the pelvis and cause misalignments in the rest of the body, which can lead to chronic pain, can be treated with certain chiropractic procedures, not necessarily medically advisable, or it can be treated just with some basic muscle and joint workouts. So that's all in the future though, alright? Good. Now just for some quick wrap-up questions, now that we've determined you seem to be in very, very good health. You aren't on any medication currently, correct? Good. Okay, so just a multivitamin. That's fine. And let's see. You play sports? Recreationally, of course. Good. Maintaining physical activity? Excellent. That's what we like to hear. And finally, how would you rate your diet on a scale from 1 to 5? 1 being very poor, not nutritionally beneficial, and 5 being very nutritionally beneficial. Okay, and can you give me just a couple of the foods that you eat on a day-to-day, week-to-week basis? Okay. Okay. Good. Excellent. All right, those sound very good. And excellent. That just about wraps us up. Wonderful. All right. Now that we've determined that everything's good, you really are in very good health, so you should count yourself very, very lucky. I'm going to schedule you for another appointment about 6 months from now, if that's okay. Just a quick follow-up. We like to do that with our first-time patients here, and make sure that everything, that the snapshot of you that we have right now is accurate month to month, okay? The purpose is just to make sure that we didn't catch you at either really a bad time or a very ideal time. So in 6 months, we just want to follow up with you and make sure that you're still going strong, okay? Good. Excellent. I'll have the receptionist set that up for you. And you are covered under insurance, correct? Wonderful. No copays for physicals, of course. So if you'll just walk out, sign out, and then make sure that you have a good day and time for you to come in for that follow-up physical, okay? Wonderful. It's been an absolute pleasure. Very nice meeting you, and I hope to see you again in 6 months' time. Hopefully not before that, okay? Excellent. Wonderful. Thank you so much for coming in, and see you again. Bye-bye.